Well, I think this study is important for several reasons. First, the study stands on itself as a positive trial demonstrating the superiority of Crizotinib compared to two reasonable standard cytotoxic chemotherapy regimens in the second-line management of non-small cell lung cancer. So all the patients when entered in this trial had been demonstrated to have the ALK abnormality. They had already received platinum-based therapy, so this was a second-line regimen. And basically the study showed an improvement in response rates, an improvement in progression-free survival, but no improvement in overall survival associated with Crizotinib. And the reason for that is very clear, very straightforward, and should be understood. And it is the reason why PFS, or response rates in some settings, but certainly PFS should be considered the standard endpoint in oncology trials today, as opposed to overall survival. And the reason is because once patients received therapy on this trial, they were permitted to cross over. And as I understand, looking at the abstract, over 60% of the patients did cross over, which is ethically mandated, period. Ethically mandated that they were permitted to cross over, and did. And therefore, when they did cross over, there's a high probability they achieved benefit as well, which is wonderful. But at the end of the day, in terms of the trial, both groups of patients, or at least a substantial percentage of patients in the arm that didn't get ALK initially, got it later, and therefore it is not a surprise that overall survival will be the same. It doesn't mean there was no impact on survival. It means that both groups of patients achieved the benefit. So this is not a negative trial, it's an ethical trial.